All right, let's talk about in-water ventilations and when we would do them. In-water ventilations are going to be done if there's no possibility of getting the victim quickly to shore to provide definitive care. The best example that we have is we pull the victim up in deep water, and it's going to be a long swim to get him back. So prioritize stopping the drowning process. And the best way to do that is providing in-water ventilations. Now, let's do the setup. A good position that you have the rescuer in is that the rescue tube is going to be supporting of the victim in a way that you don't have to have our hands doing anything, so hands free. It also opens up the victim's airway in a passive way, all right? Now, my hands are free, so if I need to grab a mask and provide the care, I can do that without having to hold or stabilize the victim. Okay, now, in-water ventilations require a good seal. If we were to try to give breaths in a lateral position doing the head tilt chin lift requires that you have a hard surface to press the head on. We don't have that in the water, so we're going to go for a cephalic position, and we're going to do the double E, double C, and we're going to go more for a jaw thrust with head extension. That's what we're going for. Now, the challenges you just need to be cognizant of the AMBU mask is if you're providing the double E, double C, it has a tendency to want to bend here. And if that bend, then you're going to have these gaps here and not have an effective seal. We want to strive more for a fold, okay? And when we look at the victim and we're placing the mask on, all this is nice and malleable, so this flesh. We want to make the seal. We don't want to have to crush the mask onto the victim's face and hurt the victim, so be aware of that. There's no need to crush, so with our double E, double C. The other thing is we want to be cognizant of the bridge of the nose in this mask. If it's done slightly wrong in a way and you're pressing really hard on the bridge, it hurts the victim, so be aware that you don't want to be doing that. All right? Now, pull the mask out. We pull the mask from our pack and it's in the water, we've got to shake the mask out. Okay, that's a priority. And we're placing the seal. What's really nice about this with the one-way valve is, Matt, are you ready? You can submerge the victim if you need to. So, look how far. You good, Matt? All right, nice. Now, if we're going to give breaths, remember, rescuer needs to be higher than the victim, over the victim's airway, so you can give the breaths. If we're in deep water, there might be a need, thank you, Bailey, to have a tube underneath the rescuer's arms to get a little bit higher. All right? If I still can't get high enough, we can have a secondary rescuer press down on the victim's chest right there. All right? And let's take a look. You ready, Matt? Down, down. You can push and give those breaths in. No problem. All right, so keep that in mind. Now, if you're practicing this, some of the things you need to be aware of. When you pull the mask again, like I said, make sure you shake the mask out and make sure that you haven't lost the one-way valve. It's pretty easy as you pull it out to get caught on the zipper, so make sure you have that, okay? The other challenge that you're going to have is rescuers really need to practice placing the tube. That's important. Placement of the tube and pulling the mask. That's very important, okay? We got it, Hopper?
Yes, sir.
All right.